So Monday at lunchtime, we're recording this with Minister for Health and Social Care, David Ashford, who's rushing literally from meeting to meeting. Again, I think the main thing, beyond anything that's really gathering traction, is the app. I've literally just checked it again, but you'd know that already, that it's not going to work yet. Causing some issues, really is now causing issues for some people.
Yeah, it's exceptionally disappointing. Based on the original timescales we were given, we were hoping to have it in place for the time of the border changes. They have had issues with Wales. In relation to Wales, they've had problems not getting the data uploaded, but I believe they've had issues with getting the QR side, which is what we are wanting, the QR code side, to actually function. So that work is still ongoing with Wales, after which we will be the next priority. We have been in touch with the UK government again and Whitehall to try and push in the right direction, should we say, but they've been absolutely adamant that until that level of work is completed, they won't turn to switching us on. So in the meantime, this week we will be announcing how people will be able to get certified letters for travel. In the meantime, because this is taking much longer than any of us anticipated or in fact wanted, so we recognise that there is demand there for international travel, particularly around those going on business trips or unavoidable family trips. So we'll be looking to get certified letters in place, and we'll be announcing that process in the next couple of days.
Right. What is a certified letter then?
So a certified letter comes from the department listing out your vaccine status and stamped by the department as authentic. Now, there's no guarantee countries are going to accept those, but it is similar to the system that's in place in Jersey and Guernsey.
Okay. Well, that is the big question is, do you literally go to the airport and just hope for the best almost, that you get off that plane in whatever country and they're going to admit you? Or is it, even before that, is it in the UK point before you leave for that overseas trip that you get checked for your
well different countries do it in different ways, but many do it before carriage takes place. But different countries do it. Some do it on entry to the country, some do it before you board, and that differs. It's important people check with the country they're travelling to what the requirements are and what is and is not acceptable. There's some countries, for instance, that don't accept the UK app as a verified status. So it's a mixed bag, and that's the big problem we have at the moment, is there is no international standard. Every country is doing their own thing, and it's trying to get something that will meet that and satisfy that country's standards.
Does this letter look like our passports look like a UK passport as such? Is it pretty well the same thing, or is it completely looks different? So officials look at it in other countries, they might be completely...
Yeah, so it would come from the Department of Health and Social Care over here, so it's headed up, it provides the batch details, the vaccination type, when people have had it, everything that would be required, and it's certified as a true copy. And
obviously we're jumping the gun slightly, and I appreciate you want to hold back, but will it be a quick process of people who need this sort of thing? I mean, is it an email that can come, or will it be a physical letter in the post, or what?
Yeah, so it can be a physical letter, or it can be sent by email. It can be either or. And in fact, for a couple of people who we've already done ones for, that we've done exactly that. Some have had it by email, some have had it by letter in the post. The important thing is, though, that we are asking people only to request them 2 weeks before travel. And of course, the reminder here is you only require it for international travel. If you're travelling to the UK or within the common travel area, you do not require a letter of certification. You can use your vaccine card for return to the island, and within the common travel area, particularly travelling into England, you do not need proof of vaccination.
And remind me, because things have moved, where are we with traffic lights? Are we on the UK system now completely, or
no,
not?
We're not. The regulations remain the same.
Yeah.
That will be considered as possibly potentially part of the next set of changes to regulations, which will come later this month. We will look at that. That's not a guarantee. We will follow the UK traffic light system, but it is one of the considerations under discussion.
So anyone leaving the common travel area, well, you don't approve any of it, do you?
We are currently on return. Anyone who's been outside the common travel area, regardless of vaccination status, has to isolate for 7 days plus 2 tests.
And that carries on for how long?
Well, until the regulations are changed and the change is approved by Tynwald.
Okay, I mean, we are a bit behind this, aren't we? Slightly. I mean, we've got this sort of freedom, but not.
As we discussed last week, I mean, there were pros and cons with traffic light systems, as we discussed last week. Yeah. The pros is it's very simple to follow, because we just mirror what the UK does. The con is the fact that the downside of it is the fact that they change quite frequently. So we only have to look what happened to Portugal, where you had a load of people who were out in Portugal enjoying holidays, gone even for the football, and then suddenly the UK said actually the status of Portugal has changed, and everyone's frantically trying to get back. So traffic light systems aren't necessarily the panacea to all ills, because when you move through a traffic light system, you can do exactly that. You can move very quickly from green to amber to red. So there's pros and cons with it, and we need to weigh those up when we consider whether or not we're going to go down that route.
And I'm assuming travel insurance is a very tricky thing, because that relies on the government regulations, doesn't it? You are insured for the travel if it happens. I mean, those people who are going to be travelling for business on this piece, this letter of yours, will they? Do you know how that will work? I mean, the letter, remember, is only showing vaccination status. Yeah, that's all it's
Travel
doing.
Insurance will normally work off the risks of you being stranded in a country.
Yeah.
Things that travel insurance will pay out for.
If you can't,
you're not going to pay out. Well, you wouldn't get into the country in the first place.
Yeah, but therefore you might want insurance to pay out
the letter
for your flight.
Well, it depends whether travel insurance will cover that. Different travel insurances will have different policies. So, for instance, there's some policies with travel insurers that don't cover COVID-19 at all.
Yeah.
There's others that have it up to a set limit. There's others that cover if there is a lockdown, but don't cover other scenarios. If people are travelling, people have to take responsibility for their own private travel, and the two things that are absolutely crucial and important is, firstly, they check that they have adequate travel insurance, what they would deem adequate to cover eventualities, and that secondly, they check beforehand with the country they are travelling to what the conditions of carriage are.
Are you delaying this whole business then about travel because the app's not working? Because obviously, as you said, you can go in the common travel area without this app, but you can't get any further. So is this you holding back, basically, now?
No. We set the last set of regulations last month, and we always said the review for the next set would be in late July, because we've got one more sitting at Tynwald, which is next week, and whatever is passed in that Tynwald, after that, the House of Keys dissolves in August. So whatever we pass in July is likely to be the last iteration of the law until after the Keys comes back in September. So we always said we would bring forward fresh regulations in July to allow us time as to what needs to be in place over the summer.
Yeah, and you keep talking about people having holidays or trying to get holidays. They're in flux still until that is decided, right? Okay, just make it absolutely clear. You're saying it's a technical issue about this app, right? Because I'm hearing that it's not. I'm hearing that there's something going on legally wise here in the Isle of Man, and Manx Care comes into it, and there's okay.
We can cut that dead now. The answer is
fine,
no,
because it was fairly all of the
legal paperwork is fully completed, is with NHS Digital. NHS Digital has confirmed receipt of all that paperwork. It's been confirmed at Minister of State level and signed off. It was signed off by the previous Secretary of State as well, that NHS Digital could commence the work for the Isle of Man. So we are purely waiting on the workload of NHS Digital.
Perfect. And when it goes live, you'll be obviously letting us all know, and everyone will go live if they've got this app. We talk about it's worth getting the app sorted out right now, because there's things you've got to do, haven't you, to get it all signed up.
Yeah, I would urge people who want to use the app to download. Yeah. But again, I do need to stress the app is only of use for international travel. If you're travelling within the UK, you do not require the app.
But you still need to do this form 36 hours before you come back.
For the return forms, you need to do the landing card and also your vaccination exemption if you are 2+2 forms. But again, there is other forms of proof. You do not need a certified letter, and you do not need the app in order to do that. So
lots of people having tests at the minute, aren't they? Lots of people. I mean, I've heard the schools, some classes are really like half the pupils are missing. They've all been asked to self-isolate, therefore they have to go for testing. Are you under stress on that part of the procedure at the minute?
There's been a couple of days where there's definitely been spikes, and the testing capacity has come under pressure, but generally the team are coping admirably, I've got to say, with the volumes that are going through. We are well within the volume limit on most days that the testing capacity can do. In relation to the schools, it certainly has put the schools under pressure, because that again has been where there has been quite a bit of an outbreak, and the way that obviously school kids interact means they have a lot more close contacts than perhaps we do as adults. But again, as we move forward, it's an ideal opportunity for me to say, the way we look at COVID and the way we look at contact tracing will also have to be up for discussion. As we start living with COVID, that means exactly that from my point of view. We need to start living with it in the same way we live with other diseases, and obviously we don't shut down everything. for other diseases. And as we complete the vaccination programme at the end of August, that is the point then when I think we need to be having conversations about how things look going forward. This again is an interim stage, including the use of vaccination status even, and it all needs to be reviewed again in coming weeks.
And the dashboard, where we're up to? I mean, what's the latest hot off the press numbers you got at the minute?
I think 86 active cases is the
Are you worried
current. No, because it's not about active cases, Paul. As we've said, it's around hospitalisation and serious illness, because that is exactly what we had all the lockdowns for, was to protect the NHS. So, the number of cases isn't actually of a concern, and there is still currently, certainly as we do this interview, no one in hospital with COVID-19.
And track and trace are on top of most things. I mean, that still goes on.
So the track and trace continues as normal. We haven't seen a take-off in cases at the moment anyway.
Well, we just had a big football event, so there might be,
yes, as we did in January, or the January or February outbreaks, and the vaccination programme is in an exceptionally good place.
Okay. And vaccines then, just to finish with, you said it's come to an end. Is it August?
So everyone who is asked for a 2+2 to be vaccinated will reach 2+2 status at the end of August.
Yeah. And then you got rid of the one down the airport, but what then there's a pause, is there, until you decide what's going to happen next?
Yeah, so we need to know what's happening with the booster programme. That's still not confirmed from the UK yet. We've had some indications, and then we need to decide, as I think we've discussed before, what the best model is to actually deliver that, if we continue with a hub system or we look at other models around primary care, but that will be decided in coming weeks.
And any more news for these people who don't want any vaccinations at all? What's the future for them?
Well, as I say, my personal view is vaccination status is a temporary stage. We know the vaccination does reduce transmission. It doesn't remove it, but it reduces it. We also know it reduces the likelihood, from recent reports by the ONS, of people contracting COVID. So it makes sense at this stage to allow a different pathway for those that are vaccinated than those that are not. But that's not the permanent situation. As with everything that we've done, it's been a stage at a time. This is just one more stage on the way, and what we need to get back to is completely unrestricted travel, and that means unrestricted travel regardless of vaccination status.
It seems like it was so far away and it's getting closer, but not quite there yet. Thank you very much for the interview. I do have to point out that you've now declared as a candidate in the House of Keys general election for Douglas North, and other candidates are there, and you'll find them online.
Other candidates are available, as they say.
Yes.